page 2 now. The Patient Protection and Affordable Care Act does neither. It does not protect patients. It does not make health care more affordable. President Obama has declared that the argument over Obamacare is over. The law is here to stay, he says. But lawyers at the Pacific Legal Foundation in California say otherwise. To borrow a phrase from the Revolutionary War, they declare that they have not yet begun to fight.
Several lawsuits are still pending in some of the nation's highest courts, challenging the constitutionality of Obamacare. Our case, Sissel versus Department of Health and Human Services, challenges the constitutionality of the individual mandate on the grounds that if it is a tax, as the Supreme Court said a few years ago, it's still unconstitutional because it originated in the Senate, and the Constitution requires that all taxes originate in the House of Representatives. During our oral arguments in the D.C. Circuit Court of Appeals in May, the judges had some questions about the procedural aspects of the case and whether we were allowed to sue at this time. We filed a supplemental brief arguing that we can, and the Obama administration has recently filed a brief of its own, admitting that our case can go forward. This makes it more likely that the Supreme Court will ultimately resolve the issue.
And there are many more lawsuits challenging Obamacare that have yet to be resolved. But what do doctors and healthcare workers think of Obamacare? After all, they're the ones on the front lines keeping Americans healthy. Joining me now from Atlanta, partner at Georgia Urology, Dr. Barry Zisholt. Hi, Barry. How are you doing today?
Good, thanks, Tommy. Thanks for having us.
Great to have you. So, Obamacare, or the Not-So-Affordable Care Act, as I like to call it, how has it impacted your practice?
I think that the country is starting to realize that the access to care is becoming less and less for the average patient. The Affordable Care Act was instituted to try to get people coverage. And although many people will have coverage, they're finding the wait time longer and longer. And just to go back to what happened with the VA, I think whatever happened to the VA is just a small snapshot of what's going to be happening to the average person in our country.
How has, you brought up the VA, how has that VA scandal and now these VA people coming over to other practices, has that impacted your office at all?
A little bit, but we're used to taking care of VA patients. The problem is that when there's no incentive and when patients have to wait longer and longer, and people and the physicians and various VA hospitals are not incentivized in any way, shape, or form, quality care gets affected. In addition, we see that with the Affordable Care Act. Even today, 3 patients I had today that nobody is willing to see because of the type of coverage they have. So although people will be having insurance, quote unquote, they're not being treated. So the line and the wait to see doctors and specialists are becoming greater and greater.
So obviously Obamacare has been a hot mess. So if bureaucrats wouldn't have been behind this and medical professionals like yourself, how would you have done it differently?
Well, you see, had they included the average physicians, I think they would have had a much better health care plan. I don't know of any doctor that doesn't want every person in the United States covered. I don't know of any doctor that doesn't want pre-existing conditions eliminated. I don't know of any doctor that would not want to insure their child till age 26. The problem is politics and how this was done. We didn't need 2,800 pages of pork and stuff to get that done. All we needed is people to be honest with the American people and to be honest with our patients and the physicians. So in order to have done that, the politicians and the presidents could have said, look, we're going to give 15 million people some good health care. It's going to cost more for everybody because it already has. Premiums and deductibles have already gone up. You can't give something for free to people and expect it to be cheaper. So if they were honest with the American people, they would have said it will cost more. Everybody can keep what they have, but we're going to subsidize 15 million people to have some sort of insurance. Instead, they tried to revamp the whole thing. And in my opinion, there's nothing, whether it's the post office, the TSA, that the government can do better than the private sector. And that's why we have this mess.
So does Obamacare really benefit anyone at the end of the day?
I think that some people will get insurance and somebody will see them. But more and more today, every time I schedule certain x-rays, many places and many radiology centers are not taking certain insurances, and these patients are waiting and waiting, and at times it's quite dangerous.
Can you explain to us a little bit of the red tape that you've had to go through because of the Obamacare mandates?
I think every patient and every person in this country is going to have to deal with some of this, and I'll give you an example. Every day when I arrive to the office at about 9 a.m., there's a stack of approval documents that I have to sign for various insurance plans. So as a physician, I'm allowed to write many prescriptions, whether it's testosterone, whether it's other drugs, and I get denied until I have to fill out other forms to get it approved. This is getting worse and worse, so it's taking us our time. So could you imagine, it's going to affect anybody, a person who's getting a prescription either for themselves or a family member has to wait to get prior approval so that the drug companies and insurance companies can get the cheapest product for their patients.
It seems like it's more so just distracting you from the nature of your practice. Is that fair to say?
Well, it certainly takes up a lot more time. And when you get these denials, you have to fight. And I tell my patients to call up their insurance company and protest because they pay a monthly premium to have insurance, and yet they're being denied specific care and specific drugs.
Well, it looks like this Affordable Care Act seems to be not so affordable after all. Thanks